Hello, everyone. I'm Alex.
And I'm Emma. Welcome back to English Simple Podcast.
Today, we're talking about something very important. Hospital English.
When you're sick or injured in another country, you need to know the right words and phrases.
We'll cover everything from making an appointment to describing symptoms, from talking to doctors to getting prescriptions.
This could be life-saving information, so pay close attention. Let's begin.
Let's start with making a doctor's appointment. In English-speaking countries, you usually need to call ahead. You can't just walk in. When you call, say, "Hello, I'd like to make an appointment with Dr. Smith, please."
The receptionist will ask, "What is this regarding?" or "What seems to be the problem?" You can say, "I have a headache," or "I have a sore throat," or "I'm not feeling well."
They'll also ask, "When would you like to come in?" You can say, "As soon as possible, please," if it's urgent, or "Do you have any openings this week?"
They might offer you a time. "We have an opening on Tuesday at 2 p.m. If that works, say, "Yes, that works for me, thank you." If not, say, "Do you have anything earlier?"
At the end, they'll confirm your appointment. They'll say, "Okay, we'll see you on Tuesday at 2 p.m. Make sure to write it down or add it to your calendar."
When you arrive at the doctor's office, go to the reception desk. Say, "Hello, I have an appointment at 2 p.m. with Dr. Smith. My name is Emma Johnson."
The receptionist will ask for your ID and insurance card if you have one. They might also give you forms to fill out. These forms ask about your medical history, allergies, and current medications.
Important words on the form. Allergies means things that make you sick, like certain foods or medicines. Current medications means pills or medicine you're taking now. Previous surgeries means operations you had before.
After you fill out the forms, return them to the desk. Then sit in the waiting room. They'll call your name when the doctor is ready. "Emma Johnson, the doctor will see you now."
When you enter the exam room, the doctor or nurse will greet you. They might say, "Hello, I'm Dr. Smith. What brings you in today?" This means, "Why are you here?"
Now you need to describe your symptoms. Symptoms are the problems you're feeling. Be specific and clear. For example, "I have a fever and a bad cough," or "My stomach hurts," or "I twisted my ankle and it's swollen."
The doctor might ask, "When did this start?" You can say, "It started 3 days ago," or "It started this morning." They might also ask, "On a scale of 1 to 10, how bad is the pain?" 1 is mild, 10 is severe.
Be honest about everything. If you have other symptoms, tell the doctor. Say, "I also have a headache," or "I've been feeling dizzy." The more information you give, the better they can help you.
Let me teach you some common symptom words. A headache is pain in your head. A sore throat is pain when you swallow. A cough is when you make a hacking sound from your lungs.
A fever is when your body temperature is too high. You feel hot and sweaty. Chills are when you feel very cold and shaky. Nausea is when you feel like you might vomit or throw up.
Dizzy means you feel like the room is spinning. Fatigue means you're extremely tired. Shortness of breath means you can't breathe easily. A rash is red spots or bumps on your skin.
For pain, you can describe where it is. "I have chest pain," or "My back hurts," or "My knee is sore." You can also describe the type. "It's a sharp pain," or "It's a dull ache," or "It's throbbing."
After you describe your symptoms, the doctor will examine you. They might say, "Let me take your temperature," or I'm going to check your blood pressure. Or, I need to listen to your heart and lungs.
For your heart and lungs, they'll use a stethoscope. They'll say, take a deep breath in and out. Just breathe normally and follow their instructions. They might also check your throat by saying, open your mouth and say, ah.
If you hurt a body part, like your arm or leg, they might touch it and ask, does this hurt? Be honest. Say, yes, that hurts, or no, that's okay, or a little bit.
Sometimes they need to do tests. They might say, we need to do a blood test, or you need an x-ray, or let's do an ultrasound. Don't worry, they'll explain what they're doing.
After the examination, the doctor will tell you the diagnosis. That's what they think is wrong. They might say, you have the flu, or it's just a cold, or you have an infection.
Then they'll explain the treatment. Treatment is how to fix the problem. They might say, I'm going to prescribe you some antibiotics, or you need to rest and drink lots of water, or take this medicine twice a day.
If they give you a prescription, that's a paper that tells the pharmacy what medicine to give you. The doctor will explain, take 2 pills every morning with food, or apply this cream 3 times a day.
Always ask questions if you don't understand. Say, can you repeat that, please? Or, how long should I take this medicine? Or, are there any side effects? Side effects are other problems the medicine might cause.
After you see the doctor, you might need to go to a pharmacy to get your medicine. In American English, we say pharmacy. In British English, they say chemist. Both mean the same place.
When you arrive, go to the counter and say, hello, I have a prescription. Give them the paper from your doctor. They'll ask, what's your name and date of birth? This is for safety and to confirm your identity.
They might say, it will be ready in 15 minutes, or you can pick it up tomorrow. If it's urgent, say, I need it today, please. It's urgent. They'll try to prepare it faster.
When your medicine is ready, they'll call your name. They'll give you the medicine and explain how to use it. Take 1 pill twice a day, or apply this cream to the affected area.
They'll also tell you warnings. Don't drink alcohol with this medicine, or this might make you drowsy, so don't drive. Listen carefully. If you have questions, ask, can I take this with food? Or what if I miss a dose?
Let me teach you some important medical words. A prescription is medicine ordered by a doctor. Over-the-counter medicine is medicine you can buy without a prescription, like aspirin or cough syrup.
An injection or shot is medicine given with a needle. Stitches are threads used to close a cut or wound. A cast is a hard covering for broken bones. Crutches are supports to help you walk.
An allergy is when your body reacts badly to something. Common allergies are to peanuts, shellfish, or certain medicines. Always tell doctors about your allergies. Say, I'm allergic to penicillin.
Chronic means long-term or ongoing. For example, I have chronic back pain. Acute means sudden and severe. For example, I have acute chest pain. These words help doctors understand your situation.
Now, let's talk about emergencies. If something is life-threatening, call emergency services immediately. In the US, call 911. In the UK, call 999. In Europe, call 112.
When you call, stay calm and speak clearly. Say, I need an ambulance. My address is, then describe the emergency. Someone is unconscious, or someone is having a heart attack, or there's been a car accident.
If you're at the hospital emergency room, go to the triage desk. Triage means they decide who needs help first. Say, I need help. I have severe chest pain, or my child is having trouble breathing.
Emergency rooms are very busy. If your problem is not life-threatening, you might wait a long time. Be patient. The most serious cases are seen first. This is normal.
Emergency words you should know. Unconscious means not awake and not responding. Bleeding heavily means a lot of blood. Choking means can't breathe because something is stuck in the throat. Seizure means uncontrolled shaking.
Let's talk about payment. In many countries, healthcare is not free for visitors. You might need to pay. At the desk, they'll ask, do you have insurance?
If you have travel insurance or health insurance, say, yes, I have insurance, and show them your insurance card. They'll handle the paperwork with your insurance company.
If you don't have insurance, they'll tell you the cost. They might say, the consultation fee is $150, or your total is £200. You can pay with cash or card.
Before leaving, ask for an itemized bill. That's a detailed list of charges. You might need this for your insurance company. Say, can I get an itemized bill, please? They'll print it for you.
Let's quickly cover dental emergencies. If you have a toothache, you need to see a dentist, not a regular doctor. Call a dental office and say, I have a dental emergency. I have severe tooth pain.
Common dental problems. A toothache is pain in your tooth. A broken tooth is when part of your tooth breaks off. A lost filling is when the material inside your tooth falls out.
The dentist might say, you need a filling, or this tooth needs to be extracted, which means removed, or you need a root canal, which is a procedure to save an infected tooth.
Dental work can be expensive. Always ask about the cost first. Say, how much will this cost? Or, do you accept my insurance? Many dentists offer payment plans if you can't pay all at once.
Mental health is just as important as physical health. If you're feeling very sad, anxious, or stressed, you can talk to a doctor. Say, I've been feeling depressed, or I've been having panic attacks.
The doctor might refer you to a therapist or psychiatrist. A therapist is someone you talk to about your feelings. A psychiatrist is a doctor who can prescribe medicine for mental health.
Common mental health terms. Anxiety is excessive worry. Depression is feeling very sad for a long time. Stress is pressure or tension. Panic attack is sudden, intense fear.
There's no shame in asking for help. Mental health is important. Say, I need help. I'm not okay. Doctors are there to support you, not judge you.
Sometimes you need to see the doctor again. This is called a follow-up appointment. The doctor might say, come back in 1 week, or I want to see you again in 2 weeks.
Before you leave, schedule this appointment at the front desk. Say, I need to schedule a follow-up for next week. They'll give you a date and time.
If your symptoms get worse before the follow-up, don't wait. Call the office and say, my symptoms are getting worse. Can I come in sooner? They'll try to fit you in.
When you return for the follow-up, the doctor will ask, how are you feeling? Be honest. Say, I'm feeling much better, or I'm still having pain, or the medicine isn't working.
Let's review the most important phrases. To make an appointment, I'd like to make an appointment with Dr. Smith, please.
When you arrive, I have an appointment at 2 p.m. My name is Alex Carter.
To describe symptoms, I have a fever and a bad cough, or my stomach hurts.
To ask questions. How long should I take this medicine? Or, are there any side effects?
At the pharmacy, I have a prescription, and when will it be ready?
In an emergency, I need an ambulance. Or, I need help. This is an emergency.
For payment, do you accept insurance, or can I get an itemized bill?
Here are some cultural tips for visiting doctors in English-speaking countries. Always arrive on time for your appointment. If you're late, they might cancel it.
Be honest with your doctor. Tell them everything, even embarrassing symptoms. Doctor-patient conversations are confidential. That means private. They won't tell anyone.
Don't be afraid to ask questions. If you don't understand something, say, I'm sorry, I don't understand. Can you explain that in simpler terms? Good doctors will help you.
Bring someone with you if possible. A friend or family member can help translate or remember information. Say to the doctor, "This is my friend. They're here to help me."
Write things down. Bring a notebook to write important information like medicine names, dosages, and instructions. You might forget later, so write it down during the appointment.
Time to practice. Let's do some role plays. Imagine you're calling to make an appointment. Say, "Hello, I'd like to make an appointment. I have a sore throat."
Good. Now imagine you're at the doctor. Say, "Doctor, I've had a headache for 3 days. It's getting worse."
Excellent. Now you're describing pain. Say, "It's a sharp pain in my lower back. It hurts when I move."
Great. At the pharmacy, say, "Hello, I have a prescription. When will it be ready?"
Perfect. In an emergency, say, "Help, I need an ambulance. Someone is having chest pain."
Wonderful. You're doing great. Keep practicing these phrases so they become natural.
That's it for today's lesson on hospital English. We covered so much.
From making appointments to emergencies, from describing symptoms to getting prescriptions.
We really hope this video helps you feel more confident if you ever need medical care in English.
Remember, your health is the most important thing. Don't be afraid to seek help if you need it.
Before you go, please subscribe to our channel. We make helpful English videos every week.
Give this video a thumbs up if you found it useful.
And comment below. Tell us, have you ever been to a doctor in another country? How is your experience? Or tell us if there's another topic you'd like us to cover.
We're here to help you learn English in practical, useful ways.
Take care of yourself, everyone.
Stay healthy and keep learning.
See you in the next video.
Goodbye.